Thank you for joining us today regarding laboratory testing for the cardiometabolic patients. So that would actually include patients with hypertension and heart disease, any kind of heart disease, and metabolic issues such as insulin resistance, diabetes, obesity, and such. So before moving on to the functional medicine testing that could be quite costly, we can utilize our local laboratory for many tests and very low cost test as well. So you'll have them listed at the bottom of this slide, but we'll go through them individually. So first we're going to talk about the lipid panel. So you hear about the cholesterol testing, that's usually what it involves. It includes 3 types of cholesterol and the triglycerides. So for the cholesterol, the total cholesterol is the sum of 3 cholesterol, the good, the bad, and the ugly. And the HDL is the goodness, it's actually protective on your arteries. The LDL is one that goes high with inflammation, and the VLDL, the ugly one, is the one that goes high when you have elevated triglycerides. Actually, its role is to carry the triglycerides. So that comes from fat, from sugar and starches, not from steak and eggs. And the triglycerides should be kept under 90, not 150, like it says in your regular blood test. So, of course, the inflammation is the root of all heart disease, so testing inflammatory markers is very important. So the C-reactive protein is a good test for checking inflammation. That also goes higher with infections, but it's a good marker for heart disease as well. So you'll have to look at it in context. The homocysteine would be elevated in patients that have kind of a genetic predisposition to heart disease, and that would show the need for B12 and the specific kind of B12 and folate, so methyl B12 and methyl folate need. Uric acid is a marker for gout, but it also tells us if the patient is having a poor diet and unbalanced diet as well. The sedimentation rate is also a good marker. It's pretty unspecific. It could be high in infection as well, but again, in context, it's important. Metabolic syndrome and dysglycemia. So to check this, we look at the hemoglobin A1C, which is the average blood sugar over the past 2 to 3 months, and that needs to be under 5.7. The fasting insulin needs to be under 14, because if your insulin is higher, it means it's not very efficient, so that would tell us that you have insulin resistance. Then thyroid testing will be covered later on, but it's very important in treating metabolic disease, because obviously if your thyroid is not functioning correctly, then you'll tend to, if it's hypo, to gain weight. Your cortisol is an adrenal hormone, but it tells us that if it's elevated, you'll tend to have central obesity, like a belly. And if it's too low, you'll be craving too much sugar. So either way, it's not very good. And vitamins, minerals, and fatty acids are very protective for the heart. So their right level are very important. So the magnesium, the RBC magnesium, is better than the serum magnesium in testing for magnesium deficiency, which can give you angina and all kinds of other health issues. Electrolytes are the other chloride, potassium, and calcium. All of that is very important to check for heart disease. The vitamin B12, better tested as methylmalonic acid. The folate. The mean cell volume is part of the CBC, so that would actually tell us if you're deficient in folic acid and B12. And the serum CoQ10 is very protective for the heart. CoQ10 is one of these enzyme fatty acid type that is utilized in the battery part of the heart. So the heart is working very hard, beating 60 to 80 times a minute. So it needs a lot of CoQ10, and it's depleted in patients that take cholesterol medications. So it's important to test it. Vitamin D and vitamin A are very important as well for general health, but also for the immune system. Now, if we just recap everything we talked about, those are the tests that you need to order to see your general health as well as your cardiometabolic health. And if you have a little bit more time, you can also do some genetic testing to see if you have predisposition for heart disease. So those are a few genes that I kind of mentioned at the bottom, but they're not, those are just a few of many, all included in that same DNA test. And if you're interested in finding out, we have another little talk on the DNA testing. And of course, after having all these results from all the laboratory testing, we'll be able to really cater a treatment for you according to your own biochemistry, and as well as give you lifestyle changes and stress management tips. So thank you for your time, and we'll see you soon.